Hello there, and welcome to today's Psychology Podcast, created by Leanne Quinn, a fourth-year undergraduate student on October 29, 2015. Today, we'll be learning about depression. What exactly is depression? How is it diagnosed? And we look at a particular psychological approach to treating someone with depression, the humanistic approach. So what is depression? Depression is a mood disorder that affects how you think, feel, and behave. It can cause persistent feelings of sadness, worthlessness, and hopelessness, and can lead to a loss of interest in career, relationships, and hobbies that were once a source of happiness and fulfillment. However, it is important to remember that depression is not sadness. According to the DSM-5, the diagnostic tool for mental health disorders, 5 or more symptoms of a depressive episode must be consistently present during the same 2-week period in order to diagnose someone with clinical depression. What can be done to help? Great question. There are many psychological approaches to treating someone with depression. However, the approach that we're going to learn about today is the humanistic approach. The humanistic approach was developed circa the 1960s when humanistic psychologists believed existing approaches failed to take the human experience into account. Some fundamental assumptions of this approach include the uniqueness of individual experience, the existence of free will, the importance of subjective experience as a primary indicator of behavior, and the need for self-actualization. What is self-actualization? Self-actualization stems from psychologist Abraham Maslow's 1943 paper, A Theory of Human Motivation. In it, Maslow proposed that there were 5 stages of motivational needs that, once met, culminated to a self-actualized person, someone who realizes their full personal potential and finds meaning and purpose in their lives. This became known as Maslow's hierarchy of needs theory. How does this fit into the humanistic approach? Let's take a look. If we take the assumptions of this approach in that all humans have unique experiences, free will, and a need to realize their own true potential, then you would also have to assume the individuality of treatment. Enter leading psychologist Carl Rogers and his person-centered therapy approach. Rogers, understanding that no two people will experience anything in exactly the same way, saw the need for a more individualized account of human experience in order to effectively treat someone, for example, who suffers with a mental health disorder. And so PCT was born. The aim of PCT is to create a genuine, caring, and inviting relationship between the therapist and the client to increase a person's self-worth, reduce the level of incongruence or disparity between the ideal and the actual self, and help the client become a more fully functioning person. Key components of this approach include unconditional positive regard. Despite disapproval of some of the client's beliefs or actions, maintaining a positive, non-judgmental attitude towards the client. Empathy, the ability to understand sensitively and accurately what the client is feeling. And congruence, or a genuineness to the therapist and their interaction with the client. Can this approach be used to help those suffering with depression? Yes, it can. While there are many different types of therapy, psychologists Leslie Greenberg and Jean Watson found that PCT was just as effective in treating adults with major depression as other therapeutic approaches. They propose that the most important factor for effective treatment is the relationship in which the therapist focuses empathically on the client's internal world and promotes exploration of feelings and meanings attached to the events in their lives. While further research suggests incorporating specific interventions with PCT, it seems the fundamental message is clear. Sometimes we just need someone to listen and understand. As the saying goes, a problem shared is a problem halved, as long as it's with a positive, understanding, and genuine person. So in summary, depression is a mood disorder that affects how you think, feel, and behave, and can be diagnosed using the DSM-5. Though there are many approaches to treating depression, we learned of the humanistic approach, psychologist Carl Rogers' person-centered therapy, including unconditional positive regard, empathy, and congruence. If you are concerned about your own mental health after viewing this podcast, please visit your GP, as there is not enough information in this video for a self-diagnosis. Thanks for watching!
Free created using Powtoon.